Hello everyone and welcome to this special edition of ETC3 TV. I'm Kristy Lindstrom. Today's program is one program in a series of 5 that will air this month through the end of the year right here on ETC. And the program is called Your Mental Health Matters. It's okay to not be okay. And the program is part of a larger mental health awareness series that is the program or the impetus of Fannin County Family Connection and other supporting organizations, including the Blue Ridge Community Theater, Fannin County Division of Family and Children's Services, Highland Rivers Health, the North Georgia Autism Foundation, North Georgia Mountain Crisis Network, and also the Raque Center. So all of those supporting organizations making today's show possible. According to statistics, 1 in 5 adult Americans will have a diagnosable mental health condition in any given year. So the purpose of this campaign and this program is to let you know that you are not alone. It's a monthly monthly television talk series, airing the 3rd Thursday of each month at 3 o'clock right here. And again, it's going to be on Facebook Live too. So if you can't catch the television program any of those 3rd Thursdays at 3 o'clock, you can catch it on the Fannin County Family Connection Facebook page. And also we'll share it to the Fannin County Family Connection YouTube channel once the television program is ready to do that. And you can get all of the resources about mental health on the Fannin County Family Connection website at fcfc1.org. My special guest in today's program, I'm so excited to welcome them all to the studio. First, you will meet Sherry Morris. She's the Executive Director of Fannin County Family Connection. Also, Anna Speessen. She's a Fannin County Family Connection board member, and she is the organizer of this entire initiative for Fannin County. Also, you will meet Michael Mullet. He is with Highland Rivers Health. You'll meet Stephen Miracle with Georgia Mountains Health, and also Dr. Kyle Raque with Blue Ridge Psychological Services. He is a psychologist in Blue Ridge who serves our community. So we have many guests today and many guests to come in this series. So we thank you for joining us today. But let's begin our program today with Sherry and with Anna. Ladies, welcome to the show.
Thank you.
Well, we are so excited that you're here. And before we dive into what this mental health initiative is, Sherry, I want to start with you. What is Fannin County Family Connection? Because people watching may have not heard of the organization before, and we want to make sure that we lay the groundwork for who you are as an organization.
Sure, thank you, Kristy. Well, the vision statement for Fannin County Family Connection is a community of healthy and safe children and families. So that gives us lots of angles that we can work in the community. One of the most things that we're known about in our community is we run the food pantry, but we also have lots of other activities. We try to bring as many educational events to the county as possible. We also host a monthly collaborative that we invite all folks, all social services, any faith-based organization, any person in the community who is just interested to attend that. And that typically happens on the first Wednesday morning in each month. We begin at 8:30. We're usually out of there in about an hour and 10-15 minutes, and there's a lot of education that goes on and a lot of sharing between organizations and agencies. And it's a very beautiful thing when an agency is in need of something and they request it there among that group of folks, and someone else in the room says, oh, I have that and I'll share. And so it works really well for us.
Now, regarding the pantry, if we can just kind of step off topic just a second, the pandemic.
Yes.
I know that Fannin County Family Connection didn't slow down a single day. So
Not
many
at all.
jobs were closed. People had to stop their lives, but the work of the Fannin County Family Connection Food Pantry continued. How has the pandemic impacted the food pantry?
In the very beginning, in the first 3 to 4 months, we had an overnight 40% increase in the number of clients that we have. Of course, we serve a community that's a tourist community, and so a lot of our younger families are working at those restaurants downtown or in those retail stores, that sort of thing that closed immediately, and they were wondering where they'd be able to get their food and to feed their families and that sort of thing. So we had an immediate 40% increase. For the year, we ended up with a 21% overall increase. And we're lucky that we had a great number of volunteers who said, you know, I'm still going to come, because we cannot run our operation on just the 3 staff members that we have. So we were very lucky. We did not have to close a day, and I know the numbers are going up now. Unless there's something that happens inside our building, we plan not to close this time as well, because so many families depend on us.
Now, during a time of the pandemic, people were not able to raise money. I know that you could not have fundraisers that you had planned. So how do you provide all of this service without being able to raise money for an organization like yours?
We have been very blessed. The community realized that, and so a lot of times, even if we weren't doing any sort of fundraising, which we could not do, our hands were tied on that, folks who normally would have given at one of our fundraisers, like our Christmas fundraiser and that sort of thing, they sent a check anyway, and we are so grateful for that. We could not have had our doors open and served so many people without our constant supporters.
Now, how did this mental health awareness campaign get started, or the idea of that? We know we need these services in our community, and we'll have so many people to speak to that today, but how did this idea of adding this mental health awareness or initiative to the plate of Fannin County Family Connection, how did that develop?
We received our Region 1 of Family Connection, which is the 15 northwestern counties. We received a grant from Resilient Georgia, and we've used that money for all of us to become trained and to be able to offer trainings and to be able to help our community with something like a pandemic or mental health or whatever. And through that, each one of those 15 communities offered a civic dinner. And so we actually tried to get people who were our clientele from the food pantry to come in, some of our other agencies to come in. We even went through the school system and had 2 or 3 of our bus drivers that came in, because no one in a community sees children and families twice a day like our school bus drivers do.
Yeah.
So we had all of those in. We had a great evening. 36 people sat. We had 3 questions that we were asking, and it was like, you know, how did you get through? What did your family need? What gaps in services could you have used? And we had a whole long list of activities. And on those was mental health and the access to mental health. And then when our board began looking at that, we realized that in a survey last year, in the 50 states, Georgia was last in access to mental health. And then if we added in the District of Columbia for 51, Georgia was number 51. And so we realized, looking around at how few providers that we had in the community and how the pandemic has actually brought forth a lot of folks with that were doing well, but then when they were shut in and couldn't go out and couldn't have the socialization that was needed, we understood that there would be many people who would need the services. And so that was the one, out of all the ones that was there, that was the one that we felt was the most needed and necessary at that moment. And that's how we began this venture into awareness and looking at everything that we can offer into the community or work with partners to make sure we get into the community.
And Anna Speessen has been tasked with this overall mental health initiative. And Anna, how did you get tasked with this large project? Because this is massive.
It's when you break it into small pieces, it's not as large as it seems. Our board chair, Kathy Cox-Springfield, asked me if I would spearhead the strategy team and identify the needs that were generated from the civic dinner and see how our collaborative members can be part of creating and implementing a program that would change or improve the lives of our community, the families and the children in our community. So I do think that working together, we can have a bigger impact than anybody who works alone. So the very first meeting that we had 16 members on the call, from everywhere from just community members to our nonprofit organizations. And we just had a general discussion. And the themes that they noticed that their clients, the services their clients were missing, were also things that came up in the civic dinner. And mental health is what the team decided to focus on. And when you look at mental health and our community's value of mental health and the attitude toward mental health, it has a very negative stigma. So we wanted to start an education and intervention program to change the negative stereotypes around mental health and around people who have mental health issues. So that's our overall goal. So we're hoping that the mindfulness activities that we have through the campaign will help people understand mental health. We are hoping that people will be able to support people who have mental health issues, and then we're hoping that people will actually seek services if they're in need of mental health support.
And in addition to this initiative here on television, what are some of the other things that you have planned, and what is the time frame of this program, or does it continue into the future?
Well, I'm hoping it continues. I'm hoping that this focus, this general focus that we have for the next 6 months is just a catalyst to more things to come. We have the monthly talk show, so thank you for hosting those. We really appreciate that. And then in October, we're having a community watch party for the movie Angst. And the movie Angst starts that conversation on how to live with anxiety. The movie focuses on teens and children who live with anxiety, how they deal with living with anxiety, and how do they find hope that, with that mental illness. So we'll have 3 opportunities to watch the movie. If you can't join us in a live viewing, you can register and we'll send you the code, and you can watch at home and then join the discussion, the panel discussion afterwards.
And you can find information about Angst and the viewing parties on the Fannin County Family Connection website at fcfc1.org. Just click on that mental health tab at the top, and then this mental health talk series or that calendar, all of that information will be posted there. So I know that the dates of those programs are still being set, so there may be some changes and some dates, but that'll come in October, right?
Correct. Yes, the last week in October.
Yes, and we're doing that along with Red Ribbon Week at the school, because we think it's important that we get the young people in our community involved in this as well.
Very good. And what do you want people to know, I guess, as they watch this program? I said, you talked about the stigma, and Dr. Raque wants to speak to that too, that there is such a stigma. Even I was asking Dr. Raque, like, how do we talk about mental health? Is it illness? Is it disorder? Is it what word? And he said, well, that in its very nature is some of the stigma. So we're going to hear from the professional which words we should use. But how else, what should we do among, just when we're talking to our friends? Maybe it's just being open about having a discussion, right?
Right.
Yeah. And there's such a myth around, like if we talk about these topics, they may happen, or they're taboo. There's that Southern charm, where, how you doing? I'm okay, it's okay. And when deep down inside you might not be. And I just think if you share your story to someone and share how you found hope or how you found support, it might, motivate other people to find services. So I think just starting that conversation, that community conversation, it happens in our community. It's here. 1 in 5, you said earlier. So there's how many of us in the room? Yeah. So it happens. It's here. And I think we just need to remove that negative stigma. People who suffer with mental health can lead productive lives.
Absolutely.
And that's we just need to remove that negative stigma. Yeah.
And I think that Michael Mullet with Highland Rivers Health will share this, as he shared on this program before, that in the realm of opportunity there at Highland Rivers Health, that you may be receiving service from someone who also shares a struggle with mental health. And they actually hire a lot of individuals who have had their own struggles because they can help work with somebody. They know what a person is going through. So I'm sure he'll share that, but he shared that before. So I think that's right. You just need to open up the conversation, and hopefully we're doing that starting today.
Right.
So,
And then the initiatives up to this point. So just as a reminder, this mental health series is airing the 3rd Thursday. We hope that's easy. 3rd Thursday, 3 o'clock each month, August through December, right here on ETC, and also on the Fannin County Family Connection Facebook page. And also something that you did, we didn't mention, is there was a proclamation signing
Absolutely.
earlier this year. Tell me about that.
We approached the county commissioners and we requested them to declare May as Mental Health Awareness Month for Fannin County, and they unanimously supported that. And so the first week in May, they definitely signed the proclamation declaring Mental Health Awareness Month for May.
And that goes right along with the National Awareness Month.
So we thank those commissioners and our new chairman
Absolutely.
Hensley
Yes.
for supporting this initiative.
Right.
So the monthly health series, or mental health series that you can watch here, the movies, the movie previews or the movie showings will be in October. And again, watch on the Fannin County Family Connection Facebook page. There's a lot of initiatives there, so social media
Right.
is part of what you're doing. And then the website as well. And
Lots of resources on the website.
Lots
Yes.
of resources. And if anybody is watching that maybe they're not part of that monthly collaborative that you mentioned, and they're not part of this initiative, how do they reach out? How do they get involved? And do you need more people to get involved?
Absolutely, absolutely. If you're interested in being part of the collaborative, part of this group that's working specifically on mental health, again, we meet the first Wednesday of every month at Fannin County Family Connection, which is 501 Fannin Industrial Park. If you're in Blue Ridge and you know where animal control is, we are straight up the hill from animal control. You don't see the building. I'm not telling you wrong. Just go straight up the hill from animal control and we're there. You can also call our offices, 706-632-6063. Ask to be placed on the mailing list for that. And you'll get a couple of reminders 12 days out from the meeting, and then just 2 or 3 days ahead of the meeting. And we welcome everyone there. If you're interested in our community and you're interested in what Family Connection is doing or any of our other agencies, we want you in that room.
And if you don't want to go to the room,
we have that on Zoom.
Zoom,
yes,
yes,
we
okay.
absolutely do. And you know, if folks are worried about the transmission now with the Delta variant and those sort of things, we also run simultaneously with Zoom. We work very hard to make sure that everyone knows who's in the room, and we repeat questions and that sort of thing. So if you can't be there in person, then do join us on Zoom.
and from the perspective of this mental health initiative, if anybody wants to reach out to you to find out how to get involved, can they do that with you directly?
Oh, absolutely. You can, my office number is 706-946-5465. And then you can reach me also through Sherry. Absolutely. We would love to have additional people because, you know, many hands make light work, so to
That's
speak.
right.
And you may have an idea that the group hadn't thought of yet.
Right.
So absolutely.
Well, we thank you so much for being here today. We've gone beyond our first segment of the show
I know.
today. But it's always fun to see both of you, to talk to you, and we're so honored to be able to share information about what you're doing there at Fannin County Family Connection and all those supporting organizations. And we wish you the absolute best with your outreach for this mental health awareness campaign. And on behalf of ETC, we're happy to share the story here that third Thursday of each month. So join us, and thank you for being here today.
Thank you.
And we are going to take a quick break, and when we come back, you will meet Dr. Kyle Raque. He is a psychologist. He's going to shed light about what mental health awareness is, or what mental health is, some of disorders that we need to talk about and how those are treated. And then later in the show, we're going to talk about our community resources and where you can seek help if you're struggling. So stay with us. We'll be right back. Welcome back, everyone, to this special edition of ETC3 TV. I'm Kristy Lindstrom. We continue our conversation now about a mental health campaign that's going on in Fannin County, an ongoing campaign. It is created by Fannin County Family Connection and many supporting organizations. And the title of the campaign, the title of the series, is that Your Mental Health Matters. It's okay to not be okay. And joining me in this segment is someone who knows all about mental health and mental health disorders, Dr. Kyle Raque. He is a psychologist. He's located in Fannin County. He is with Blue Ridge Psychological Services. Dr. Raque, thank you for being here today.
Thank you. Thanks for having me.
And something that we had discussed when we were communicating about the show today is that the scope of your practice may have changed as a result of the pandemic.
Yes.
People's
absolutely.
lives have changed. Tell me how your practice changed because of that.
Sure, absolutely. I would say it changed in a number of ways. For sure, there seems to be an influx of people that are in need of services. So we saw a greater number of people calling, to get services because they were having an increase in anxiety or depression or things of that nature. We also saw an increase in the number of referrals that were coming in from primary practitioners in the area and surrounding areas. So just a huge influx of people, I guess, that resulted, I'm sure, from the increase in stress and the isolation that people felt as a result of having to stay home more often or losing their jobs or things of that nature. So the mental health issues that they were normally able to maybe cope with through their resiliencies, they were kind of taxed more and pushed to the point where they needed more help, professional help. So we saw an increase in that. And then the other major way that we were impacted is that we had to adapt to providing more virtual services. So throughout the pandemic, we were able to offer almost always some in-person services when necessary. We actually, kind of funny, purchased several of the big heaters that you see in restaurants and set them up outside on the porch out back. So we actually had a office that was kind of a makeshift office, if you will, outside under the propane heaters. So you do what you have to do.
You have to pivot. That's
Absolutely.
Right. Yeah.
But we definitely explored the whole virtual mental health area way more. We've tried various platforms and experimented and figured out how to get forms to and from people, and all of that stuff was quite challenging, but now I guess we're much better for the wear in order to be able to provide services now for people, whether it's in person or virtually now.
So this pandemic is new for all of us. So as a psychologist, as a mental health professional, how do you learn how to serve others in this unknown time and space?
Sure. It can be challenging. I would say for sure that collaboration is probably the biggest way that I've learned. Fortunately, I'm fortunate to be a part of a group practice, so we have multiple practitioners there that we can talk together, troubleshoot, and figure out what to do, and also listen to our clients and hear their feedback and what they're comfortable with. And then also being more involved in agencies and the such to find out and research the best ways to provide care.
And when we talk about mental health, the purpose of the show is to really just remove the stigma, to have an open, honest conversation. When we talk about mental health, what is it? What are we talking about? Sure,
absolutely. Well, I mean, I kind of look at everybody as we're kind of born with certain vulnerabilities and resiliencies in our life. We all have, things that are really strengths for us, and I guess, that we have no problem doing, and then we also have vulnerabilities. So a lot of those vulnerabilities might involve mental health sort of issues that can develop if we're put under enough stress that we might, at some point in our lives, almost all of us, in fact, are going to have some form of mental health issue that arises. I heard that, in the segment prior about the 1 in 5. And I think Anna pointed out that, how many of us are in the studio, but that's just at any given time. If you think about it, if you follow somebody through the lifespan, almost everybody at some point is going to have some form of mental health issue. And it ranges, the gamut, depending on that particular person's vulnerabilities. The good thing about it is that we can also build up a person's resiliencies and teach them how to, whether it's through psychology or counseling or whatnot, how to build those resiliencies up, reaching out to other people, becoming involved in our communities, various things that we can do to help ourselves keep those vulnerabilities under control.
So when you talk about depression, anxiety, what is the list of things that fall under mental health disorders or issues that a person might have?
Sure, absolutely. Great question. So I noticed that you pointed out in terms of the issues and disorders that the official way that these things are categorized as we call them disorders, mental health disorders. But certainly when I think about disorders, I think about them more as issues because I don't want to label a person with a disorder. It just sounds like a bad sort of thing.
So to destigmatize, we want to talk about issues. We don't want to talk about disorders, we want to talk about issues.
That's definitely how I prefer to talk about it. And when I talk to clients, when I talk to to other practitioners as well. I generally speak in that voice. I talk to them as I would talk to my family member, you know. I don't want to say you have a disorder. That makes people not want to, you know, they think something's wrong with them. Well, yes, you're feeling something wrong with you, but you're feeling something that's normal throughout the life process. That's an issue. It seems like a better way to describe it to me. But yeah, so it really runs the gamut. There's certain issues that tend to develop in childhood. You know, ADHD, I guess, is a common one that people have probably heard a lot about before. But also anxiety is certainly one, and the anxiety comes in all forms, all shapes and sizes. There's and then depression, of course, is a major one that people have heard about. And then, you know, some more significant issues that people face sometimes, such as bipolar, and which is just another mood issue, a mood stabilization issue that people have. And then, of course, psychotic issues such as like schizophrenia, which would be, you know, pretty significant, obviously.
And how do you treat those? Because I'm taking notes. I want to be educated today
Sure.
too. So when I
Sure.
repeat information or share information that I'm correct, how do you treat those issues? For example, can we go through that list? You mentioned ADHD. Do you work with someone comes and sits in your office and they go through a therapy process and that helps that person, or what are the therapies?
Sure, absolutely, yeah. So I would say like one of the first steps is just in terms of identifying what the issue is.
Okay.
So a lot of times we want to make sure that we aren't incorrectly labeling people with an issue. We want to make sure that they actually, you know, meet the diagnostic criteria for that particular issue. So with ADHD, for example, what that might entail is doing a psychological evaluation of that child. Hopefully the person is caught with that as a child, because if that happens, then we can intervene at multiple levels. So treatment is not necessarily just about, you know, sitting back in a chair or laying on a couch, as you know the old I guess view of psychotherapy is. But it's also intervening with the community in terms of the school, in terms of the parents, the system at home, the family system. So the psychologist or the therapist is trying to intervene on multiple levels once that person or that issue is identified, whether it's, you know, with the family system or in therapy, or even medications, for example, that we sometimes use to treat some of these issues.
So what about, you mentioned anxiety, depression.
Sure.
How are those treated?
Sure, absolutely. So with anxiety and depression, a lot of times we use, almost every therapist has a different modality of therapy, but there are a lot of commonalities. So in general, cognitive behavioral therapy is like a kind of a catch-all term that we can use that encompasses a lot of different therapies. And what that really is targeting is to try to teach people ways in which they can think about the thoughts that they're having, how they can think about them in a different way that promotes those resiliencies I was talking about. Whether it's thinking more positively or thinking through, like using specific cognitive tricks such as you know, mindfulness or meditation. It really is something I've found that it's important to find out what that particular person will respond to best, where they're at, what they like, what fits with them, what interventions fit with them, and then applying those interventions and helping guide them through. And sometimes you go down one road and you have to change direction. But the point of, I guess, is that there's a variety of interventions that we can use in therapy that can be really helpful to help somebody with depression or anxiety, to lift their mood, to help expose them to anxiety, for example, to learn how to calm themselves down, whether it's cognitively or changing the behaviors that they're doing. And we get a lot of positive results just from therapy.
And what if somebody is diagnosed, the next one on the list that you gave was bipolar?
Sure. So I guess the first thing I would say about that is we want to make sure that that person's properly diagnosed, because that does seem to be one that sort of has become a catch-all in our time. So we want to make sure that is actually properly identified, that someone actually truly has bipolar disorder versus, you know, just a depressive situation. So that would be one important aspect of treatment. But a lot of times people who do have real severe mood issues are going to need some medications. So what we try to do is coordinate with a psychiatrist or a psychiatric nurse practitioner. And sometimes, because of the area that we're in and the limited resources, sometimes we do rely on providers, primary care providers in our communities to assist in that type of treatment. And then when it becomes more complex or the person is having issues and they're not adapting well to the particular medication regimen, we can utilize psychiatric services via telehealth for those folks.
And then, what did I write down?
Schizophrenia?
I wrote it down. I spelled it wrong. Schizophrenia.
Sure,
yes.
sure.
So if someone comes to you and what is that process to determine that is what that person's dealing with, and then how would you handle that?
Sure, absolutely. Well, if someone presents in our office and they have what we call psychotic issues, which would be hearing voices or seeing things that aren't there. Sometimes, keep in mind, I want to make sure people understand that these types of things can happen in a perfectly normal person, for example, going through a bereavement where they've lost somebody. And they might think that they see that person, or they might actually see that person. I'm not going to say whether they do or not, but what I want to make sure of is that people understand that the clinician will take all those things into consideration when determining. But once we've determined that person is in fact having psychosis, then we're going to want to get the intervention started very quickly. So the medications that we have to treat schizophrenia are very effective. So we would definitely make a psychiatric referral in that case and have that person get started on a medication regimen. We'd also like to provide some psychoeducation in terms of teaching that person about what this particular problem is, where it comes from, how to handle it, but also educating the family system and the community around them as well to help support that person in their treatment. And a lot of times people can live perfectly, really good lives even with a diagnosis as difficult as that.
And are there any other particular issues? Those were like the broad headings, I think, that you discussed of the particular types of issues one could have.
Sure.
Are there ones that we missed?
Yeah. I definitely one other one that I didn't touch on would be autism spectrum disorders.
Okay.
So I noticed that you mentioned the North Georgia Autism Center,
Yes.
and Trip Ritchie and our office are often engaged in back and forth in terms of him identifying and helping to refer people for testing. So with that particular issue, that is something that we really, really want people to identify early, because if we can identify kids that are on the autistic spectrum early in life, say even as babies now, we're learning how to do that as babies. If we can intervene with them early, we can start those interventions, which are mainly behavioral interventions, by the way.
And if a parent is watching and they have a young child, and what are they supposed to look for?
Sure. So they want to look for oddities in behavior and social interaction. If the child is having particular issues in terms of communicating back and forth, the reciprocity that you and I are having now in our conversation, if they seem detached from that and they are unresponsive, if they are doing any kind of odd repetitive behaviors, hitting themselves, rocking back and forth incessantly, things of that nature. And once they get older, if they're having difficulties in school, difficulties establishing relationships with peers, things of that nature. So it's really communication is a big issue as well. So it's really about identifying early on and getting that intervention. And so the assessment is the biggest part of that early intervention. And once those kiddos are assessed, then we're able to get that kiddo down the direction of treatment, which is called ABA therapy, which is a real intensive behavioral treatment. And the wonderful thing is that if we can intervene early, a lot of times those kids, by the time they're preteens or teenagers, you could test them again, and that they're a trained, highly qualified psychologist will not be able to even tell that they had autism. Some of them. Now that's not always the case, but a lot of times it's really important to get that early intervention, particularly with that particular problem.
And I feel like for a lot of these that you've mentioned, that early intervention is the key for all of these, to not let a problem linger, but to seek help so that if you'll talk about this in our next segment, but if someone comes to you, you're going to do that thorough assessment and make a decision yourself about what you think that person is dealing with based on what you're listening to them say to you.
Absolutely.
So assessment and that early intervention is key for all of these.
It's really critical. Absolutely. Identifying that early on and asking that, knowing what questions to ask and knowing, what to rule out and to continue to change the formula in terms of what you think it might be going on until you arrive, hopefully, at the issue at hand, and you're able to provide the intervention early on. Certainly, even like with anxiety, if I can enable a young person to learn how to cope with their anxiety when they're like a preteen. A lot of times I have preteens that come to me. If I can empower them to learn how to deal with that anxiety early on, it's remarkable how much better off they're going to be as adults when, let's face it, we all have stress that comes on in our lives. If they can learn how to deal with that anxiety early on, then they are much better capable of dealing with it, the next round. So.
Well, I appreciate you being here today to share this information, and we're going to continue our conversation with Dr. Raque when we come back, because we'll also be joined by Stephen Miracle of Georgia Mountains Health, and also Michael Mullet. He is with Highland Rivers Health, because we want to have a conversation about what services that we have in our community. If you are someone that doesn't have insurance, if you're a self-pay person, or whatever the case may be, there's places where you can go with sliding scale pay services. So we want to just have a conversation coming up after this about where you can receive help, the kinds of services that are offered, and how you pay for those services. So we will talk about that when we come back on this special edition of ETC, so stay with us. Welcome back, everyone, to ETC3 TV. I'm Kristy Lindstrom. Today's program is part of a special 5-part series airing on ETC the third Thursday of each month, this month through the end of the year at 3 o'clock right here on ETC. And the program is entitled Your Mental Health Matters. It's okay to not be okay. It's an initiative by Fannin County Family Connection and many supporting organizations, and you can learn more about this initiative on the Fannin County Family Connection Facebook page, as well as their website at fcfc1.org. There's a tab for mental health, and you can find all the information there. And I am grateful for our guest today, Stephen Miracle with Georgia Mountains Health, in the orange there on the end. Thank you for being here today.
Thank you for having me.
Mr. Michael Mullet with Highland Rivers Health, thank you for being here.
Well, thank you for having me back.
And also Dr. Raque, thank you for continuing our conversation.
Absolutely, thank you.
So what we want to talk about in this segment is what are the mental health resources available to us in our community. We want to create awareness. What do we have at these organizations, and how do we obtain service? So, Stephen, I want to start with you. Georgia Mountains Health, what services are provided there overall, and specifically mental health?
So Georgia Mountains Health is a nonprofit, community-based organization that provides behavioral health, physical health, and dental health care for people, basically on a sliding fee scale. So we don't turn anybody away. We have people who have no insurance and people who do have insurance that come to our practice. From a behavioral health standpoint, we started a behavioral health division in earnest about 2 or 3 years ago, and we now are staffed with 3 behavioral health specialists covering all 4 of the offices that we have in the 4 counties in North Georgia.
And which are those counties?
Murray, Gilmer, Fannin, and Lumpkin counties.
Okay. So they have a big territory to cover.
They do.
3 people.
They do. And so we're not every day in every office. That doesn't work.
Okay.
But we do have at least 3 days of coverage in each of the offices.
And what is the process for getting connected with someone there? Can they walk through your door? Do they have to have a referral from a physician, somebody
No.
else? How does it work
No.
there?
One of 2 ways. Because we are also a medical group, we have internal referrals that come from providers. A lot of primary care physicians actually see patients who have mental health issues, anxiety and depression.
Sure.
And so if we can get those people to a more appropriate professional, then we're helping not only the individual that is suffering with anxiety or depression, but we also free up time for physical health care. So one way is through a direct referral from one of our physicians or nurse practitioners. The other way is a direct referral. So patients who, maybe a mom or a dad who has a child who is anxious, can call up and get an appointment with one of our providers.
Okay. All right, Mr. Mullet, we want to move to you with Highland Rivers Health. What is Highland Rivers Health?
Highland Rivers Health is we're technically called a community service board, but our role, and we serve 12 counties in Northwest Georgia, we're a safety net agency. So we exist to provide behavioral health services, treatment for mental health, for substance use, also serve individuals with disabilities. Services for people who otherwise might not have access to those services. So low income, people who are uninsured, people who might have Medicaid or Medicare. Like Georgia Mountain Health, cost or inability to pay is not a barrier to receive services. We too have a sliding fee scale. We have some contracts with the state of Georgia, and depending on your financial circumstances, we may be able to have them support the cost of your treatment or services. So it really just depends on your situation, but we don't turn people away because of inability to pay.
And your locations close by are where?
Well, as you mentioned, we're trying to find a therapist that could work in Fannin County. DFACS has generally offered to give us some office space in their building there, but we also have outpatient clinic in LJ. In fact, just across the street from the studio where we are here on Progress Road. We also have a clinic in Pickens in Cherokee County, in Gordon, in Whitfield County, so really all over.
And how does one receive service from you? I mentioned earlier that you educated me on a previous show about the process of open access.
Open access.
And I've got my sheets here today. Those are also on the Fannin County Family Connection webpage to understand the open access process and what you expect during your first visit at Highland Rivers Health. But how does one become a patient there or receive service there?
Well, the first time, like you mentioned, it is open access. So someone will go in, not with an appointment, but during open access hours, and will be seen on a first come, first served basis. It's not maybe ideal that people want it that way, but that's how we have to do it right now. And for people who may have a little more need or higher acuity problems, we will tend to move them up ahead if
Like
we're able to.
model.
Right, absolutely. And but you do receive a full assessment during that first visit, what symptoms you're experiencing. We do look at what financial resources might be available to help you, and then after that, you're scheduled with regular appointments, probably with a therapist or with other services that meet the needs of how you might need help.
Right. And Dr. Raque, for you, you're in private practice in Fannin County. How does it work for you? How do you become a patient there that comes to see you in your office or your facility?
Sure, yeah. So we have, in our practice now, we have actually, there's 9 providers. They're varying specialties. We have psychologists, and then we have psychologists that specialize in certain areas.
Okay.
One that does biofeedback or physiological psychology, for example, and then we have another psychologist who evaluates some children for autism. But then we also have a number of other practitioners that work with families and children and also adults. But we receive referrals from primary care physicians, and then we also receive self-referrals, people that by word of mouth that have had somebody that has seen us perhaps, and they recommend that person reach out to us. So we have a website that people are able to message, directly, and that actually those messages come directly to me, and respond and try to. Once I have gotten a message that way, or we've received a referral via our primary care providers in the area, we will reach out to those people and try to connect them with the therapist that will be best for their particular situation. And then they'll come in for what we call an intake. Generally speaking, we like to try to get the paperwork sent to them via electronically now, so that when they come into their appointment, we can really focus on trying to hear their story, what's going on with them, identify how we might help, and whether or not we might not be the particular provider or whatnot for that particular issue, and so we can either work with that person ourselves, or if we identify they need other services, try to direct them, for example, for psychiatric services or other services that they might need.
And what about pay? How does that happen there? Is it an insurance model or self-pay, or what's your...
Sure, absolutely. So we accept all forms, pretty much. I don't say all forms. We accept most forms of commercial insurance, which there are quite a few, and we also accept Medicare and Medicaid. We accept all the CMOs of Medicaid, and then we do have 3 practitioners right now that do offer sliding fee. We only have a number of slots that we are able to accept, but we do offer that for some people on a limited basis. We're actually trying to renew our National Health Service Corps agreement so that we can help to bring in more providers that are able to offer those sliding fee services. So, but yeah. So.
And let's go back for each of you. Tell our audience where you're located, the particulars like the phone numbers, the things like that. I know you've mentioned those, but for people who are watching specifically in our viewing area and beyond, Mr. Miracle, let's start with you. And how do we get in touch with you? Where are you located? People may have never heard of your organization before.
Sure. Georgia Mountains Health, we have offices in Fannin County and Blue Ridge, here in LJ, in Chatsworth and Murray County, and in Dahlonega and Lumpkin County. And you can reach us at 706-946-4647. That gets to our central scheduling point, and we'll be able to schedule an appointment for you.
And as you mentioned before, that you're not going to turn anybody away there. You've
That's
got
right.
that sliding fee type scale for whatever their need may be, and that you can call in and request to come in and see someone, or you have those doctors internally there at Georgia Mountains Health that can do that referral to that mental health provider if that's what the person needs.
Exactly right. That's the way we
So
work.
kind of a one-stop opportunity there.
Yes.
All right. All right, for you, Mr. Mullet, tell me more about contacting and locations again, just repeat that.
Okay, well, in Gilmer County, our outpatient clinic is at 1179 Progress Road. So, like I said, not far from the studio here, but we also have nine outpatient clinics across the 12 counties that we serve. And we do have a centralized number, which is 800-729-5700, 800-729-5700. Even though it's an 800 number, we answer it. So it is answered by someone at Highland Rivers, and they'll take your location too, so that when you're scheduled or referred for open access, you can go to the clinic that's most convenient for you.
And open access is not every day, right?
It varies by clinic.
Okay.
So if you call the 800 number, they can tell you what days open access is at the clinic nearest to you. You can learn all about our services on our website as well, which is just highlandrivershealth.com.
Okay. Thank you for being here today. I
Well,
really
thanks for
appreciate
having
it.
me.
And Dr. Raque, go over those particulars.
Sure.
You just let it out of the bag that if they're emailing you, then
Sure, yes. So our website is just Blue Ridge Psychological Services.com, and then we have an intake number that's direct that puts you directly with our intake coordinator. And that's actually my wife. So that is 678-697-1120. Our main office number is 706-455-2490. And our location address is 9757 Blue Ridge Drive, which is, I always tell people, just down from the light where the Dairy Queen is, in a house that we've remodeled to be our office.
okay. And we were going to have one more segment on the show, but we're just up against the break with a couple minutes left. So I just want to go over just a couple more things, and then we'll end our show here. But there have been a lot of sports figures have been talking about mental health lately, and just popped up on my phone. This is a star, Ryan Reynolds, posted just this morning. I saw a quote. It says, "I know when I felt at the absolute bottom, it's usually been because I felt like I was alone in something I was feeling." So I think when people talk about it, I don't necessarily dwell on it or lament on it, but I think it's important to talk about it. And when you talk about it, it kind of sets other people free. Do you all feel like that?
Oh, absolutely.
Absolutely, yep, definitely.
And another quote that I saw from Simone Biles, another star that we know, she said, "Put your mental health first, because if you don't, then you're not going to enjoy your sport. You're not going to succeed as much as you want to. So it's okay sometimes to even sit out the big competitions to focus on yourself, because it shows how strong of a competitor and person that you really are, rather than just battling through it." That was another good quote.
Definitely.
And then tennis star Naomi Osaka, I'm sure you remember her. We hear from a lot of our celebrities. She just said that it's okay to not be okay, and it's okay to talk about it.
Yeah, definitely.
Very good. Well, we thank you all so much for watching this program today, and I thank you all for being here today. Again, Stephen Miracle of Georgia Mountains Health. He wears a lot of hats. You were just on as a blues brother, talking about the blues train with Kiwanis.
Was that me? I'm not sure.
Well, I don't know. It was a man in costume with Troy Shearbraun.
Yeah.
I don't know. Those two guys came in, and maybe it was and maybe it wasn't. And then, Michael, thank you. You've been here with Benji before during Mental Health Awareness Month, talking about mental health issues. And you shared something that I alluded to earlier in the program, that Highland Rivers Health brings a lot of people on board who had their own mental health struggles. Can you just share a little about that?
Absolutely, yes. We have a lot of people in recovery, and in fact, here at our clinic down the road here in LJ, we have a peer support program where individuals who are living with mental illness go during the day. They have strategies, activities, they share information, but all of those groups, and we have them across our service area, are led by people who are living in recovery with mental health conditions, so certified peer specialists. You know, and as I mentioned on the last show, I've had mental illness myself in the past. I don't live with it, but I certainly can appreciate the struggle. And it's hard, but it doesn't last forever if you get help. And so I would certainly encourage people to, if you're feeling bad, take care of yourself.
That's right. And Stephen, briefly share, there's going to be a partnership coming up with Fannin County Family Connection and Georgia Mountains Health about a mental health first aid class. You're opening that up to 20 individuals that are individuals who work with young people. Can you tell me about that?
So mental health first aid is an evidence-based program that covers 3 areas. It talks about the signs and symptoms of mental health issues. It talks about how to talk to young people when you notice that they're exhibiting signs and symptoms, and then talks about sources and resources that are available to help. So it's an 8-hour course. You get a nice little book that has a resource with resource information that goes along with the class, and it's being held on the 17th of September at the Family Connections office in Blue Ridge.
And you can register on the Fannin County Family Connection website. Just go to fcfc1.org, go to mental health, or go to events, and it'll say mental health first aid. You just click on that, it takes you to the registration form. I have one of those forms here. And Georgia Mountains Health and Fannin County Family Connection have graciously agreed to pay the registration fees for those 20 participants that you'll be taking in that class.
And that's excellent.
So it'll be a
course.
free
I've taken
program.
it. Yeah, very good learning in that course.
Well, thank you for partnering with
Sure.
Fannin County Family Connection to
Happy
do
to
that.
do that.
And we'll close today by talking about, we'll have more shows again coming up the third Thursday of each month. Next month, we'll be talking about September as National Suicide Prevention Month. Noel with Highland Rivers Health is going to be coming back to talk about suicide prevention awareness. And also September is National Recovery Month. And many of those individuals who've been through services there at Highland Rivers Health are going to come back with us and share their recovery stories here on air. And Michael, thank you so much for arranging those individuals to come back and share their testimonies here on the air with us.
Happy to do it.
And we thank you for watching today, the special program again, Your Mental Health Matters. It's okay to not be okay. Sponsored by Fannin County Family Connection and many supporting organizations. And we'll see you right back here next month. And also we'll share this to the Fannin County Family Connection YouTube channel once this television version is available for viewing there. And we'll see you next month. Be well.